You also alluded to the prevention considerations with medications, and I suspect you're talking about malaria, but maybe we can transition into some of those mosquito-borne diseases and what considerations need to be weighed there.
Mhm. Yeah, so again, if you check the CDC website before you travel about, you research mosquito-borne illnesses, there's an extensive list there, but I'll summarize just a few of the most common.
Sure. Yeah,
So
yeah.
you mentioned malaria. It's probably one of the most serious one. It's a parasite that is transmitted through a mosquito bite, and it could be life-threatening if left untreated. Well, with malaria, luckily we have prophylactic drugs that the patient can start taking a week or two before their trip. They have to continue taking them during their trip and also after they come back to make sure if they caught something towards the end, they're still covered. So there are drugs such as atovaquone, the antibiotic doxycycline, anti-malarial agents, chloroquine, mefloquine, so all of these. So depending on the drug, they may have to take it, a couple of days before they leave or a couple of weeks before they leave. So we can, again, individualize and work with the patient on those. But there are other mosquito-borne illnesses. So Zika virus, for example, and this is mostly important for pregnant women because of the risk of birth defect. Another one is dengue or dengue fever, which is common in tropical and subtropical areas. And so that one can cause fever, body aches, but there's a complication with dengue that is hemorrhagic dengue, which
Mm,
is rare, but something also to keep in mind. And then chikungunya, which is has a vaccine. We'll talk about it in a minute, but the other ones don't have a vaccine to prevent. And for Zika and dengue, for example, there are no prophylactic agents like malaria. These are viruses. So the best way to counsel the patient on those is the use of non-pharmacological ways to
mm.
prevent, using EPA approved insecticides, wearing protective clothing, long sleeve shirts, long pants, which can be tricky because most of them are
Right.
hot and humid areas, but that's
Mm-hmm.
to prevent the use of mosquito nets for over the beds.